Welcome to Never Again Is Now, a podcast about anti Semitism. I am Evelyn Marcus. My co host Phyllis Zimler Miller cannot join us today. Anti Semitism is growing in professional environments. Today we will discuss anti Semitism in the healthcare sector. Peggy Shapiro is the executive director of the Center for Combating Anti Semitism, CCA. She is a leader in Jewish advocacy, Holocaust remembrance, and Israel education, and was named a distinguished professor by the City Colleges of Chicago. She develops training programs against anti Semitism for professional environments. Peggy, welcome to our show. Thank you so much for coming on.
Thank you for having me.
So, um, you started the Center for Combating Anti-Semitism. When did you start it? Why did you start it? And what does it do?
Well, I have been with Stand With Us
Mhm,
since I retired from the City Colleges of Chicago,
mhm,
and I was working on a whole variety of efforts with Stand With Us. This Center for Combating Anti-Semitism training started sometime after October 7th. Why I did it? I'm a child of Holocaust survivors. My parents were teenage Holocaust survivors. They met after the war, fell madly in love, and chose life. They had me. I'll never understand their ability to be so positive and have children after what they experienced. But all growing up, I heard from them, never again, never again. Now they're gone. And after October 7th, what was unleashed by Hamas, and then around the world, the wave, the tidal wave, the tsunami of anti-Semitism made me realize that now it's my turn. I have to promise my parents never again.
mhm, mhm. Wow, that's powerful. So you were born right after World War II, after they were um,
Well, they met after
liberated. They were liberated from a
they were
camp.
liberated in Germany from concentration camps to nearby concentration camps, and I was born in Landsberg. And as you know, Landsberg is where Hitler wrote Mein Kampf.
Oh,
His promise that I would never be born, no Jewish children would be born, and here I am.
yes, and yes. So you and I share the core motivation for doing our work against anti-Semitism. I think it's because of what our parents have experienced, and we just feel the obligation to do everything in our power to let it not happen again. Correct?
We must, there's no choice.
Yeah. So you're organizing a conference on March 15 in Las Vegas about anti-Semitism in the healthcare sector. Why is such a conference needed?
Every year, Stand With Us has its annual international conference, and this year we decided to include a full track on healthcare. And it's needed because anti-Semitism, as you know, is not a historical issue. It's a growing real-time threat, and healthcare institutions are not immune. We Jews represent just 2.4% of the population, and yet we are the targets of 68% of the religious-based hate crimes, and that's
Hmm.
according to the FBI.
Hmm.
Almost 70% of Jewish adults have experienced anti-Semitism. And we conducted a study because we were getting lots of reports about anti-Semitism in the healthcare, but we thought, well, maybe it's isolated incidents. It can't be. It cannot be in medicine. And so we conducted a study. It was published in the Journal of General Internal Medicine, and we found that nearly 40% of Jewish healthcare professionals report experience anti-Semitism in the workplace, not
Wow.
online, in the workplace. And more than a quarter of them felt unsafe or threatened in their
Mm.
professional or academic settings.
Wow.
We followed up with more intensive research in the Journal of Religion and Health and found that two-thirds of the incidents occurred in academic medical centers. Now, when you think about healthcare, healthcare is built upon safety, ethics, trust. It started with the Hippocratic Oath. When anti-Semitism exists within healthcare institutions, it undermines professional integrity, staff well-being, and patient care. And so this makes the conference not optional, but necessary.
Wow. Yes, I'm shocked by these numbers that there 40% of healthcare workers, Jewish healthcare workers, have experienced anti
And this
Semitism
is
in the
from
workplace.
32 states. Yeah.
So, and so, and the patients, do they also experience anti Semitism as far as you know?
We've heard from patients and practitioners,
Mm-hmm.
both.
Mm-hmm.
The responses might be a little different, and I think we're going to be talking about that, but patients are afraid.
Mm.
Patients are hiding their identity.
Wow.
I'll give you one little story. There's a man in my community, a very courageous civic leader who proposes legislation and fights for it and fights against anti-Semitism. And he was going into the hospital recently for a minor procedure. After October 7th, when Hamas attacked Israel and there was the anti-Semitism, it became engulfed the world, he decided to take a stance and he put a tattoo of his name in Hebrew on his chest. Now he was going into the hospital. He was going to
Yeah.
wear a hospital gown
Yeah.
and be unconscious. And he was terrified. He called me, Peggy, where can I go? So, yes, it impacts
Yeah.
everybody.
Yeah. Yeah. Um, could you give us some examples of incidents that were reported to you from the
Sure.
healthcare sector?
Oh, one of the things we did in our studies, we gave people the opportunity to write additionally what they've experienced. And we thought there would be a few comments here and there. I have a notebook in 11-point font with 100 pages
Mm.
of incidents.
Mhm.
But I'm going to give you just a few. In San Francisco, there was an anti-Israel rally in front of the hospital there. Doctors participated in this, and there were chants of intifada from the river to the sea, and those are not too subtle calls for violence against Jews.
Correct.
Their colleagues were horrified, the patients were scared, and then the protesters went on to block a bridge, which they delayed a truck with transplant organs. This truck was delayed for 4 hours, and
Mm.
you know that you cannot delay transplant organs.
Mhm. Mhm.
The administration passed it off as just another protest as the ones in the 1970s. A nurse posted praise for Hitler, identifying as a nurse. A sports medicine physician in California referred to Israelis as pigs and baby killers and compared Zionism to Nazism.
Right.
One doctor wrote in our study that a colleague told him it would have been good if my children were captured and kidnapped by Hamas. In Chicago, a professional Facebook group for therapists blacklisted all Jewish therapists, anyone with a Jewish sounding name, anybody who expressed sympathy for the victims of October 7th, and that included blocking the Jewish woman who started the group. There have been egregious displays of anti-Semitism in medical schools. Dr. Stephen Roth, who will be speaking at our conference, uh, found so many symbols calling for violence against Jews worn at medical school graduations, and there was no administrative pushbacks. And talking about medical schools, Jewish applicants and I know this from personal experience from people in my family, Jewish applicants are advised not to mention their Jewish identity or even their trips to Israel in the application process.
So being Jewish and Israel or that's what's being kind of canceled in
Yeah, it
quite
has
some
to be hidden.
cases.
And when you hide your Jewish identity in a medical setting, it is not just ethical. It's not just a moral loss. It is actually a healthcare threat because there are genetic components. There are genetic things that the doctor should know about you with Jewish identity,
Yes.
and people are hiding it.
Wow. That's not a good state of affairs at all, Peggy. Um, who will be speaking at your conference? And when is the conference, by the way? Where is it? And who will be speaking there?
Okay, our conference begins with a healthcare welcoming event on Sunday, March 15th, and then it's all day Monday, March 16th. It's in Las Vegas. We'll give you the link to register. Once somebody registers, then they get the specifics
Yeah.
about it. The rest of the conference continues through Wednesday morning, but the healthcare track is a full day.
Hmm.
And we are bringing together leading physicians, psychologists, educators, institutional leaders. And what I'm so happy to announce is that everyone we asked said yes. I wear a little necklace here. I don't know if it says Hineni, I am here. Whether they're Jewish, Muslim, Hindu, or Christian, whoever we asked said yes. And their speakers include Kanta Ahmed, a doctor and associate professor of medicine at SUNY.
Hmm.
Miri Bar-Helprin, a PhD trauma specialist. Yael Halas, a doctor and founder of the American Jewish Medical Association. Dr. Edward Halpern, Chancellor and CEO Emeritus of New York Medical College. Dr. Zuhdi Jasser, a Muslim and founder of the American Islamic Forum for Democracy. Dean McKay, a professor of psychology at Fordham University. Dr. Mihir Margani, emergency physician and national president of the Hindu American Foundation. Jose Melendez, mental health educator and at UNLV, University of Nevada, Las Vegas. Uh, Joshua Simmons, a clinical psychologist. Hetty Wald, a clinical professor at Brown University. Jessica Smoot, clinical psychologist and educator, and of course, Sherry Ross, who's our medical outreach director at the Center for Combating Antisemitism, uh, our research director, Alexander Fishman, and me. So we're going to get a lot of information in a condensed time, but
Yes, it's
together
an
they
impressive
bring, yeah,
impressive
yeah.
lineup. Yes.
They bring clinical expertise, scholarship, trauma research, medical history, ethics, and policy insight.
Yes. So those are the subjects they will talk about.
And we talk about a variety of subjects, but what I wanted to say is this is the first time ever, not only that Stand With Us is having a medical track, but that a full day conference on anti-Semitism medical and medicine and healthcare is receiving continuing medical education CME credit. And that is from Touro Medical School, who is our
Mhm.
joint provider. So
Okay.
this reflects the professional and clinical relevance of what we're doing. Now,
Um. Yeah.
you wanted the
That's
subjects?
yeah.
Were you, okay. We are talking, starting way back, talking about medicine's complicity in the Holocaust
Yes.
and the echoes today. The history of anti-Semitism in medical education, new and emerging research, anti-Semitism today in medical education and training. And then some solutions. We talk about traumatic invalidation in therapy and resilience and the process of healing that. We're talking about building allies and coalitions across healthcare, and this is extremely important. And then we're talking about moving from recognition to response. What do we do? How do we diagnose, treat, and prevent anti-Semitism in the healthcare space?
It's that's a great list of subjects, very important. I'm thinking of a friend of mine who is who will who list who registered for a therapy group about family matters, and she's actually a bit also a bit worried to go because she's afraid of anti-Semitism coming from the group, coming from the therapist. You never know. And her family is very involved in the Jewish life. So Judaism will come up, being Jewish will come up, but she's a bit reluctant to talk about it. Let alone that she has a lot of family in Israel that she might want to talk about as well in that group. But what kind of reactions is that going to give? Is that recognizable for you from other stories you have heard?
I wish I could tell her she's wrong, but I can't. Because in mental health, we have found some of the most egregious examples of anti-Semitism. In fact, there is an entire school of therapy that is now labeling Zionism as a mental illness. So her concerns are valid. And that's why we're having specific panels and resources to address anti-Semitism and mental health because it is extremely dangerous.
Wow.
And we have to push back against these false narratives and this dangerous, dangerous way of approaching therapy for Jewish patients.
Yes. Yes. I had advised her to contact that therapy group leadership beforehand and share her concern. And they reacted to that, and they said they don't expect it to be a problem in the program. Often people, especially if they're not Jewish, don't always realize that something can come across as anti-Semitic when it's not meant to be anti-Semitic. So I hope she'll be fine. But what do you think of that approach to get information beforehand, whether being connected to Israel, being Jewish is a problem for the therapist or the group if it's a group therapy?
So generally, I think the response will be, we tolerate no hate. Very nice. What does it mean? You have to go to the next question. Can you recognize anti-Semitism? Do you train your staff to recognize what anti-Semitism is? And I'm not just talking about anti-Semitism as it appeared in 1942. I'm talking about anti-Semitism in 2026.
Yeah.
Because you can say I'm against it, but have no idea how to recognize it. And so if anti-Semitic comments are made, the therapist may not respond, not out of any bad intention, but out of ignorance.
Yeah. 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 Exactly. Out of ignorance. And anti-Semitism today is so intertwined with criticism of Israel, but then the kind of criticism that crosses the line. But many people don't even understand that. Um, and so it you would recommend employers to train employees about that. Is
So
that correct?
I want to refer back to our study. One of the questions we asked is, do you undergo anti-bias, anti-discrimination, cultural sensitivity training? The vast majority of healthcare providers said yes. And do you know how many of these anti-Semitism, or excuse me, anti-discrimination, anti-bias trainings even mentioned anti-Semitism, must list taught people how to identify it? 1.9%. And we are still looking for that 1.9% because I haven't found anybody who includes it.
Yeah.
So, although anti-bias training is extremely important in healthcare, in mental health care, it is not part of the training currently. And that's why we have our Center for Combating Anti-Semitism. We want to fill that dangerous gap and provide the training.
It's interesting when I, as a patient, um, go to my healthcare providers here in town. Um, I see in the waiting room, I get on a screen all kinds of messages for the waiting people wait in the waiting room that feeling safe is so important to the health to this healthcare institution that the patients feel safe and they can ask for chaperones and many nurses wear the badge of also being a chaperone and I can ask for a chaperone and that as a member of the LGBT community I should feel at ease and safe and accepted and no problems. And they go really out of their way to tell me that I should feel safe as a patient while receiving healthcare. And you're saying being Jewish is not part of that. Is that correct?
People are being asked to check their Jewish identity at the door, and that is with the staff, with patients, and the response of the administration is no response generally.
Yeah.
Um, I'll give you a little bit back. Over 40% of Americans don't know what the word anti-Semitism means. Far higher percentage cannot identify anti-Semitism even if they're engaging in it. And so I believe them, they want everyone to feel safe, but they have no idea of how to apply that to what I call the elephant in the room.
Hmm.
If we're only 2% of the population and 68% of the targets, uh, don't know how to apply it to us. It is not in their current training.
Yeah.
And I think what's important to know is all the isms are problematic for healthcare. Racism, sexism, all of those. But anti-Semitism presents a special challenge because it mutates. It started out as religious discrimination, hating Jews for not accepting Islam or not accepting Christianity. It became racial stereotyping around the time of social Darwinism. Then it became nationalistic, hating Jews for not having a country. That was sort of during the Napoleonic times. And then hating Jews for having a country. And then a vast series of economic conspiracy theories. So everything that was bad in society, whether it was the plague or COVID or depression, became a conspiracy theory blaming the Jews. The Jews are at fault. So, one of the main reasons that anti-Semitism has been around for thousands of years is ignorance. I often paraphrase Mark Twain, and he said, lies make the way around the world before the truth gets its pants on. And so do conspiracy theories. especially when they're now spurred on by the strong tailwinds of social media.
Yeah.
And so anti-Semitism is fueled by this lack of understanding and lack of education. And medical schools, healthcare systems, academic medical centers, they need to lead by example, and they can only start by learning.
Yeah. So they should include anti-Semitism training in their
Yeah, they should,
anti-bias training, probably.
it, if they don't, then they're not serious.
Yeah. Yeah.
Now, I'll tell you, sir, I went to one very wonderful medical system, healthcare system, and spoke to the CEO. And I said, do you do anti-bias training? He says, of course. You do cultural sensitivity training? Of course. Do you do training on diagnosing, being aware how to identify anti-Semitism? And he said, of course. I said, can you look at your training and see where it includes it? I'd love to see it because I'm still looking for that 1.9%. He came back to me a couple of days later and said, I am so embarrassed. Here we are at a hospital with quite a high representation of Jewish patients and doctors, and I had no idea we didn't include it. And I think that's the case for many.
Yeah.
They have
Yeah.
no idea.
Yeah. Yeah. I understand. So, what factors are causing or influencing this anti-Semitism going on in healthcare?
I think first and foremost is the complex nature of not understanding the mutation.
Hmm.
Healthcare workers know that if they're looking at COVID, the first manifestation, and they think this is exactly the same virus they're going to see 3, 4 years later, they're mistaken because it mutates.
Yeah.
So people will look at anti-Semitism as it appeared a couple generations ago and say, this is it. I know what it is. But it mutates, it changes. Uh, and we see now that it applies to all different aspects. And the factor is that after October 7th, I don't think anti-Semitism started. I think it was exposed and inflamed. It's as if someone had spread gasoline all over our environment and then they lit a match. And the vicious anti-Semitic uh, protests began immediately, immediately before Israel did a thing, while they were still counting the bodies,
Yeah.
began immediately after October 7th. It was planned. And as I said, these conspiracy theories on social media, they get out there. There are so many conspiracy theories, even about 9/11, that Israel was responsible, that there are people in some countries who have bought into the conspiracy theories that it's now gone from a wild accusation to what they consider common knowledge. And there was very little to push back as they were engulfing the world.
Yep. So, um, you mentioned social media influence anti-Semitism Semitism in healthcare. Um, you mentioned protests almost on October 8th. Before Israel did anything, there was a lot of anti-Semitism spread in many channels in public life. Could it also be that because the healthcare sector is so closely connected with the academic world, that we saw so much anti-Zionism, anti-Semitism erupt on campuses, that has extra affected also the healthcare sector?
Absolutely. You're absolutely right. And we found that in academic medical centers, we found Two-thirds of the incidents of anti-Semitism were in those environments. But there is another component. There, of course, are the conspiracies, people who want to propagate it. But I think even bigger, it's the silence.
Mm.
It's the silence in response to anti-Semitism. Um, when students went into a white coat ceremony at a medical center, that's supposed to be pristine. Nothing is supposed to be on your white coat. And there were all kinds of symbols on the coats, anti-Semitic symbols. That was a mistake on the part of the student. But a greater mistake was on the part of the administrator who got up afterwards and said nothing.
Yeah. Yeah.
It's the silence. Now, I am very fortunate. For many years, I was good friends with Elie Wiesel, the Nobel Peace Prize laureate. And he said, the opposite of love is not hate, it's indifference. It's the indifference. It's the silence that permits anti-Semitism to grow. And when people speak up and stand together and shed light on the situation, that's the only remedy.
Yes. That's very well said. Um, you mentioned as a policy that is needed right now in the healthcare sector against anti-Semitism is training, anti-Semitism training, um, learning, teaching healthcare workers to recognize anti-Semitism, to know what it is, to recognize it, probably to speak up against it if they see it happening. Are there other policies you hope for in the healthcare sector against anti-Semitism?
Okay. There are policies. There are definitely policies, but we have to get from an abstract policy to implementation. And
Hmm.
the only way to get there is by recognition.
Hmm.
Because uh, we may need more in terms of safety, but we have some general policies. For example, Title VII of the Civil Rights Act of 1964 prohibits religious and national origin discrimination, and employers are liable. But do they apply it to Jews? Section 1557 of the Affordable Care Act prohibits religious and national origin discrimination in healthcare delivery. But is it applied to Jews when people don't know what it is? And now we have the National Institute of Health, NIH, compliance requirements. And so funding may depend on adherence to anti-discrimination laws and uh, acts, to stop anti-Semitism. So most healthcare institutions have non-discrimination policies, but the effectiveness depends on recognition. And there is a way to recognize it. We don't have to invent it. The International Holocaust Remembrance Alliance definition of anti-Semitism has been around for a long time. It was on the State Department website in a form since the Obama administration and has been uh, there for every other succeeding administration, Republican and Democratic. And it has been adopted now by over 1,200 organizations, the EU, countries, 36 states, I don't know how many hundreds of cities. It has even been adopted by the world's largest global imams organization. So we have a tool that will guide us in identifying anti-Semitism. And so we need that consistent framework. Not everybody making its own definition, because if everybody started making their own definition, of course you're going to make a definition that excludes any of your conduct. So, but without this inclusion and anti-bias training, enforcement is challenging or incomplete or I see impossible.
Yeah. Recognition is the first step
Mhm.
necessary
Well,
before.
doctors know that before
Yeah.
they treat a disease, they have to diagnose it.
Yeah.
Can't
That's right.
diagnose it,
Yes.
you're not going to go any further.
That's right. That's right. So, if an individual in our audience today, whether he or she's working in the healthcare sector or is receiving healthcare, if a listener of this program, or you and or I, would encounter anti-Semitism in healthcare, what would you recommend us to do?
What I would recommend is before you experience it, be proactive. Call your medical center that you go to and ask them, do you have anti-bias training? Does it include anti-Semitism? And if they say no or they don't know, say, can I follow up and can you please find out? There needs to be that outside pressure because healthcare institutions want to maintain their brand of trust. As you said, trust is essential. I don't know if I can trust going to you if you don't educate your staff, your employees, your administration on what it is. So ask the questions ahead of time.
Mhm.
I invite them to join our conference, whether they're healthcare practitioners or patients, because the first step is to be informed yourself. If you don't know how to identify anti-Semitism, how are you going to help someone else do it?
So that's the um, awareness we can help create in, and a little bit of pressure we can put on healthcare institutions is to call them and ask them, are you including anti-Semitism in your anti-bias training? But if you encounter it as an individual working there or receiving healthcare as a patient, what, and you want, and how should you deal with that experience?
Every healthcare institution has a reporting mechanism for discrimination.
Okay.
Everyone, report it.
Yeah.
Ask them, how do I report discrimination? They're not all identical, but they all have them.
Okay.
If you report it and you document, I reported on such and such a day, always keep a record, a paper record of what you've done. If there's no response or an ineffective or sort of dismissive response, contact us. We'll help you get through to the right people or we'll contact them. But
Great.
don't think, oh, I must be imagining this or what will one person's comments mean? Because if you reported, you don't know. There could be 8 or 9 or 10 other people who have also reported. But just to speak up when it happens, and then we will help take action if that's warranted.
Great. That's good to know. Um, Thank you very much, Peggy, for all the information and knowledge and wisdom you shared in this interview. Is there anything we didn't touch upon that you still want to add?
We are at a crossroads now. The words you say or the words you don't say can determine the future for our children and theirs. And for anyone who's used the words never again, don't use them as a slogan. Use them as action. Report anti-Semitism. Demand that your professionals in the healthcare field are trained in it because healthcare is built on safety, trust, ethical responsibility. Addressing anti-Semitism is not political, it is professional. That's why this conference and this conversation are necessary.
Thank you very much again, Peggy. Um,
Thank you. Thank you for
and
what you do.
and we wish you lots of success with the conference about anti-Semitism in healthcare that takes place on March 15 and 16 in Las Vegas. Um, we will we will publish the link to the conference so you can register. We will publish it in the description of this podcast episode. We will also, of course, publish the name of your institution in case people want to contact you. We want to thank our listeners for listening. If you want to know more about our other podcast episodes and about my co-host and me, you can look it all up at our Never Again Is Now podcast channels at YouTube, Spotify, Apple Podcasts, and iHeart. Um, we want to ask, as we do in every episode, our listeners, we want to ask you, please speak up against anti Semitism whenever you can, in whatever way is good, fits you, and speak up against all hate.
Thank you.